Hello, everybody. Again, this is Irina and Susan. We are here to bring you regular bite-sized information on AI so you feel more empowered to start talking about it, learning about it, implementing. As I said, when Susan and I both met, we felt that we were both early adopters of AI. However, taking certifications, being on the calls, and talking to people that have been in the game for some of them over 10 years before AI was really AI, we both felt that, if you see Noah's Ark, with AI, it's kind of, leaving away, and we are like the dinosaurs. But I want to ensure you and say we're not the dinosaurs. We're still are pretty early adopters, and we're not late to the game. So let's get started. Susan,
Yeah,
where do we see AI in our everyday life where people are maybe having misconception and they don't think that that's an AI?
yeah. I think sometimes we don't think of what AI is and where it has been found. I mean, we've been using AI for a long time, but it wasn't called AI. I mean, how many people use their smartphones? And we use autocorrect and facial recognition, right? I'm always intrigued when I go to my Netflix and it's like, oh, these are movies that you might be interested in. Well, how do you know that? Well, because
Ding,
that's
ding.
part of yeah, it's part of AI. The same thing as shopping on Amazon. I'm a big Amazon person, and it's like, oh, these are my things that you're looking for. And so all of these things have become really are using these in our everyday lives for a long time. And even your badges at work, are AI assisted that we didn't even think about. So, we've used it in different ways in our everyday life for some time, and I think most of us are quite comfortable with that.
Yeah, and I would say it only, I think, in my opinion, leads to a lot of biases
Yeah.
because when you click on a video, whatever you are, you're on the left, you're on the right, you're in the middle, political, religious, you click on one video to see, and then it's going to keep feeding you
Yes.
anything that
Yes.
has that type
Absolutely.
of point of view. So people a lot of times thinking that, oh, like everybody thinks the way I think, but
Yeah.
it's because AI is like super awesome about looking at the data and just filtering what they think you're interested in.
Yeah, because
So
it's
learning
predictive.
predictive, yeah.
It's based on what you've already looked at, and it doesn't go beyond those boundaries.
Yep,
So it can
exactly.
be, yeah, it can be very, that's a very good point.
Yeah. So learning about it. So first we're going to bring you AI vocabulary, just few little things that people still have a lot of trouble kind of understanding. And I have to tell you, don't feel bad because for months and months learning that, I keep going back to the vocabulary thinking like, what is it? So let's start with something that is on top of everybody's, I think, kind of mind is when we talk about AI, what is machine learning? And machine learning is the type of AI. So think of artificial intelligence as this big umbrella term for things that we'll talk to you about. So machine learning ML is type of AI where computer learns patterns and it improves over time. So very similar to like what Susan said about Amazon, but we'll talk about nursing. So Susan, what is in nursing? What is the example?
Yeah, so here a machine learning model would analyze thousands of patients' glucose readings and then use that data to predict who is at high risk for hypoglycemia the next week or the next day or whatever the time frame is. So it's learning patterns, taking those patterns and making predictions.
Right. And I would also say it's almost like the basic level because when you
Yes.
have in
Yes.
your EMR, you have like this, predictive models.
Yeah.
And sometimes you look at it, you're like, oh my gosh, this AI is so smart because it predicted something I didn't know. It's a machine learning. This
Yeah.
is where, it doesn't have a sixth sense and it could be wrong, but based on the pattern, a lot of times it's correct.
Correct.
Then we're moving into something that's called deep learning. And that's a subset. So we said AI, underneath of AI is machine learning, underneath of machine learning is deep learning. So it's subset of machine learning that uses what's called neural networks. And that's very similar to what we have in our brain, neural networks, with many layers to process complex data, such as imaging or sounds. So Susan, in nursing, what is the example of deep learning?
Yeah, so here you can't help but go right to the images of chest X-rays, right? I mean, we look at those the examples and the the analysis of those X-rays. So here, deep learning uses an algorithm to detect, pneumonia or whatever, shadows or whatever on those chest X-rays because they are looking at those images, and that's what deep learning is all about.
Right. And I just want to say that a lot of there was so much conversations about radiologists losing their jobs, and AI and like deep learning has been used in imaging for actually probably over a decade.
Yeah,
We did not know about it because it was
right.
not kind of up in front. But we would always need a radiologist, somebody with their eye to look at it. So what this deep learning does, it number one, it alerts the radiologist and say, hey, look here, check
Correct.
here. And it also helps sometimes. I actually learned recently, Susan, that there are hospitals that are being sued for not using AI in imaging. And what happened was, I think the example was there was a hospital that used AI for detecting strokes. And the other hospital did not have that AI, and somebody had a stroke, and then they were using the hospital saying, well, why didn't you use AI to alert it? Because what AI can do is look at, let's say, 10 CAT scans that were done within the past hour, and they'll say,
Right.
beep, beep, like, look at this one, this is
Yeah.
probably
Yeah.
potential bleeder. And
Yes.
so that
Yes.
radiologist can look at it first versus number 10. So that's
Yeah.
that's an
Yeah,
interesting.
it's that early detection that, you can't have a radiologist look at ten tests in an hour. It's just not humanly
Yeah,
possible. But
yeah.
here, AI could be used in saying, you know what, this is the
Prioritize.
prioritizing
Correct.
and
Yeah.
look at that. So yeah, that's
Yeah.
a great example.
Yep. And then natural language processing, or NLP, is again the field of AI that helps computers understand and interpret human language. So this is easy to remember. It's natural language processing, NLP. So this is whatever it's written in that algorithm that helps computer to recognize the voice. So like in nursing, Susan, what's the example?
Yeah, so it takes, relevant information like medication changes, discharge instructions from the nurse's clinical notes. And then it puts it in natural language that we all can understand.
Right. And it's used right now so often where, it's called sometimes ambient scribe. This
Yep.
is where, and I was on the call with many doctors who use different types of ambient scribe, which is natural language processing models. And they actually said that after they spent time reviewing the notes, making sure it was correct and there was no hallucination, and keep giving that AI feedback, they were like, no, I said whatever, not pain, and you said pain. They said after they spend all this time doing it, which is a lot, and some people stop it. They're like, no, 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 it doesn't work. They said now they're getting back to that medicine that they love where they don't have to write. And one doctor said he doesn't open a computer anymore in a patient's room. He just
Yeah.
talks to them face to face, and it like that AI
Yeah,
gets that
how nice is
unbelievable.
that? We bring back the humanistic approach, right?
Yeah, yeah. And
Yeah.
I think once we'll start using it would be tremendous because
Yeah.
I see right now everybody kind of walks in with their computer on
Yeah.
the little wheels, and it's just
Yep.
like they don't have time. They can't even look at the patient's eye.
No,
So
no, no.
that's very cool. Oh, that came all together. I'm sorry, but
Sure.
generative AI is AI that can create new content such as text or images based on training data. So this is not where you have to sit down and say, AI, please write for me. I want to talk to Susan about our next talk. What should I? This is where AI can actually create content like based on the training set data that it has. So in nursing, what's the example, Susan?
Yeah, so here a nurse has a conversation with a patient, and the AI can actually write the draft of that nursing progress note or that nursing note, while you're actually, like you said, having a face-to-face conversation with that patient and not having to write it down. The generative AI tool puts that in a summary type of note.
Yeah,
Um,
wonderful.
yeah.
Predictive analytic, I think it's kind of, self, people can probably get that, but this is type of AI where it's using data and different statistical algorithms and machine learning to predict future outcomes. So what's the example in nursing?
So, heart readmissions for heart failure, has been a topic for many years, and how to decrease that, the readmissions of heart failure patients within that first 30 days after they've been discharged. So it uses predictive analytics to forecast which patients are maybe at higher risk. And then, of course, once you identify those patients, what can be done so we don't have that readmission within that for 30 days. So
Yeah.
again, it's really forecasting and highlighting patients that would be at most risk, or even at slight risk. And again, you just want to decrease those readmission within that 30 days and
Yeah.
have a
Yeah.
plan
And
of care.
right. And when we'll talk about biases for one of our next talk,
Yeah,
I'll
yeah,
explain how predictive analytics has to be evaluated and
yeah,
why nurses need to be at the table evaluating, because just because a hospital uses the same, Epic EMR, and maybe they're located even in the same town, it doesn't mean that their patient population is the same. So the predictive
correct,
analytics that work in one hospital might not work in the other. And
correct,
again, this is why we need to understand this and know that why do we need to be involved.
right.
And of course, clinical decision support, again, that's probably self-explanatory. That's AI or software tool that assist clinicians by providing knowledge of patient-specific recommendation. So basically, oh, I'm sorry, Susan, what's the
Yeah,
nursing
no,
example?
it basically is a tool to remind nurses, to perform a certain screening. So in this case, we're using a sepsis screen when vital signs and labs suggest early infection. So it would just kind of pop up as you're putting in, data, some type of screening tool would come up based on that data that you put in to kind of remind the nurse to say, you may want to ask this, or you may want to provide, this kind of information.
Yeah, and this is again, it goes kind of like it can become very fatigued for us when all of
Yeah,
a sudden, like the AI will look at the, really complicated patient that's elder, and it can come up with like these, 24 different clinical decision supports, like, hey, don't forget to do full assessment
correct.
and sepsis, and da, da, da. So it could be pretty fatiguing, but it also, this is where I think as nurses we come in to train that AI to kind of
Yeah,
look at what we need, and the beauty of AI is that it's like it's so trainable, and the more time you'll spend initially in like training and saying no, like, by the way, I don't know if you do this, Susan, but when I have a paid version of ChatGPT, and I've tried different AIs,
yeah,
so right now this is what I'm sticking with. But every time I ask the question and it gives me the answer, you can do thumbs up or thumbs down. And if you do
yes,
thumbs up, then that's how that AI knows that that's what you're kind of looking for.
correct.
But most of the time I do thumbs down, but I also provide feedback. I'll say, okay, this is good. However, like this is what I want you to look at.
Right.
And so that's very important. Again, why
Yeah,
we need to be
it's
involved.
only as good as the input is. And the more input we give AI tools, the better the output.
Right.
And that will increase over time.
Yeah. And I remember my statistic professor said, like with data, garbage in, garbage out.
Yeah, exactly.
So
I
if
think
you,
we've all heard that.
yeah. All right, so let's just debunk few myths, and we promise we'll let you go right now. But Susan, what are the myths that nurses are? I guess you're hearing with nurses and AI.
Yeah, I think the number one is that fear of that AI will take my job, right? But we know that uh, that's not going to happen. We can't take the humanistic approach and give it to AI. Nurses are still going to lead the care. We have to look at AI as an assistant to the nurse, as a helper. It's going to handle tasks, but not necessarily roles.
Yeah. And I'll take this one because
Yeah,
that's I learned the really difficult way,
yeah,
because as I've done research in AI, it tend to be that there's some subset of people, and it doesn't matter, nurses, doesn't matter, population, that's kind of like, I just don't know, I don't want to be involved, I'm fearful. But then the other ones are divided by half, and I don't mean half exactly half, but some
sure.
people believe that if AI provided the data, then it's 100% truth, and that's the Bible and the source of truth. And then there are other people that says if it's AI, then it's 100% garbage, don't trust it. And I would say I was more on that, oh, that's AI, therefore it's accurate. and I wrote a paper and ran it through AI, just say like check for grammar, spelling, whatever, whatever, and took all the, it was very good suggestions in terms of grammar, spelling, and like, hey, move this one here, fine, fine, fine. Okay, send the paper in. And then the editor reached out to me and she said, Irina, if you use AI for the paper, and I said, well, yeah, but just for whatever reviewing, she said, well, your references, 7 out of 10 were wrong. But I pulled my references myself. So I knew. I
Yeah.
was like, what, how could it be? I went back and looked, and what AI did is what's called hallucination.
Yeah.
And I was struck, Susan. It literally took everything that I had, instead of just saying that's as good or well formatted, it literally, it changed the name of the author,
Yeah.
it changed
Yeah.
the name.
Yeah.
I mean, it was crazy. I had to go
Yeah.
back, and of course I pulled everything. I had it, but hallucination is real, and you have to keep double checking. And even for our post yesterday, when I asked AI to just provide the table, like a nice visual summary, and I really liked it, and I posted, and I think Susan, you commented, and then I look more closely and I recognized that it used different examples and the wordings were not the same. So I was like,
Yeah.
oh my gosh. So then I went back and I said, use this accurate, correct
Yeah.
wording. Do not make any changes. Just put it in a nice table format. And
Yeah.
then it did. I didn't love the table, but I used it. So make sure you know that AI is not always accurate, but AI is not always wrong.
Right. And I think that the important piece here is that you always have, whatever it comes up with, is that you really have to check it for accuracy, relevancy, and biases. I
Yeah.
mean, those are the three things that you really need to make sure that before you use the output that is correct.
Yeah. Yeah. And I think the third one is like where I think both probably Susan and I were before we, um, you know, embarked on this journey is I was like, well, I'm not a tech expert. I don't have computer skill. Like I'm not a computer programmer. There are people that are much better trained than I am in AI, until I recognized that I was talking to a doctor that owns like an AI startup, and he said he's a practicing emergency room physician. He said I went to my leadership and I said we need AI governance because there's so much happening in the hospital, and they were like, oh, don't worry about it, like we'll just get AI to govern AI. And he was like, oh my
No.
gosh. So we recognize that you don't have to be tech expert, but you need to keep learning. And that's why I think Susan and I are here to help you, and I'll stop sharing so we can see, help you on this journey and to really try to get the most out of it. And we'll train together and bring nurses to the tables where AI decisions are made.
Absolutely. Yeah. Looking
Thanks,
forward to
everybody.
yeah, next time.
Stay
Bye.
tuned.